Dr. Daniel. And today I'm posing a title of talking, which is a question, which is, can erenumab, which is an Aimovig, cause hypertension? Well, this question is all over the internet right now, and it's really not resolved. So let me discuss it. There are 4 CGRP drugs that are approved for migraine prevention, and Aimovig, erenumab, is one of them. So we've also got erenumab, Aimovig, galantamab, which is Emgality, and those are given once every month by self-administered subcutaneous injection, whereas Vyepti, which is eptinezumab, is a similar drug given by IV infusion. They all work well for preventing migraine and have few side effects that made a great impact on prevention and treatment for migraine patients since they first came out in 2018. However, erenumab has been implicated recently as possibly causing high blood pressure. So the question is, has the FDA reacted to the hypertension problem that's been reported with erenumab? Well, I'm going to just call this drug Aimovig right now because it's not generic. It's a once-a-month subcutaneously injected calcitonin gene-related peptide, a CGRP receptor antagonist. It is approved by the FDA in 2018 for preventive treatment of migraine in adults. But in April of 2021, the FDA added a warning to its labeling about risk of new onset hypertension and worsening of pre-existing hypertension associated with the use of this drug. Well, how does erenumab work? Aimovig blocks the CGRP receptor and is a microvascular dilator. It's produced hypertensive effects experimentally in animals. What are the accepted side effects previously that have been listed for Aimovig? Well, the possible side effects are a hypersensitivity reaction. As you give a shot, it makes you sick, you can't take it anymore. An injection site reaction, which really looks like a bruise. And I've got a picture on that, the article I have on this on my blog post at drmigraine.com. It causes constipation in some folks, muscle cramps, or spasms. Well, what reports have shown hypertension from taking Aimovig? The medical letter on drugs therapy 2021 reported a retrospective analysis of post-marketing reports submitted to the FDA Adverse Events Reporting System. They identified 61 cases of elevated blood pressure associated with Aimovig use, of which 41 considered serious and 7 required hospitalization. Many cases occurred in patients with pre-existing hypertension or risk factors for hypertension, such as age over 65 years old, dyslipidemia, and diabetes. The median reported increases in systolic and diastolic blood pressure were 39 and 28 millimeters of mercury, respectively. Most cases were associated with the first or second dose of Aimovig, and of the 44 cases in which time to onset was reported, 28 of them occurred 7 days after the most recent dose. Hypertension was reported both with and without concurrent triptan use. The medical letter reviewer reported a case of hypertension that persisted for 3 months after stopping Aimovig, even after the use of hypertensive therapy. Well, is there controversy regarding Aimovig aggravating hypertension? Yes, it's all in the literature. Just bring up the subject and you'll see it. In contrast, a retrospective analysis of 4 randomized, double-blind, placebo-controlled clinical trials included 2,443 patients did not find an association between Aimovig use and hypertension or vascular events. And these trials excluded patients who had experienced a serious cardiovascular event in the previous 12 months. So Vyepti, Aimovig, and Emgality, the other CGRP antagonist approved by the FDA for migraine prevention, they block CGRP itself rather than its receptors. And their labels did not contain warnings about a risk of hypertension. Patients with significant cardiovascular risk factors were also excluded from clinical trials of these agents. Another article published in Headache 2021 October, the journal Headache, was entitled Risk of Hypertension in erenumab treated patients with migraine, analysis of clinical trial and post-marketing data. And this was reported by some of the big-time clinical neurologists who do headache, who reported in the world, about Dr. David Dodick from the Mayo Clinic, Dr. Stuart Tepper, Jessica Aliani, and persons like that. There was a directive. It was to assess for the risk of hypertension in patients with migraine who received erenumab in clinical trials and in the post-marketing setting. Now, erenumab is a monoclonal antibody for migraine prevention that targets the CGRP receptor. Hypertension is a theoretical risk for inhabitants of the CGRP pathway, although no evidence of an association between erenumab treatment and hypertension was observed during the clinical development program. Adverse events of hypertension have been identified in the post-marketing setting only. So, safety data from 4 phase 2 and phase 3 clinical trials were used to perform a pooled analysis of hypertension adverse effects in patients with migraine receiving the drug. Post-marketing adverse effects of hypertension were identified from the Amgen Global Safety Database from May 17th, 2018 through January 31st, 2020. Results in the pooled analysis of clinical trials of hypertension were low for having this with erenumab. So, conclusions. Clinical trials did not demonstrate an increased risk of hypertension with Aimovig compared with placebo. And adverse effects of hypertension reported with this drug in the post-marketing setting were generally low anyway. Additional data are needed to fully characterize the extent to which hypertension is a risk associated with this drug. And final analysis is then from the statement mainly from Dr. Dodick and his group were that additional data are needed to fully characterize the extent to which hypertension is a risk associated with the drug. So check it out. We're going to have to wait some time for other studies to be published right now. God bless all you folks who have migraine. Please click on subscribe and like down there, and I'll see you again on the next talk.